Hi, everyone. My name is Sarah Jessup, and I am a clinical psychology PhD student at Vanderbilt University, and I'm also a member of the ABCT Student Membership Committee. Today, I'll be talking about the postbaccalaureate experience prior to beginning mental health graduate training. And the goal of this webisode is really to provide a comprehensive overview of the postbaccalaureate experience, specifically what it's like, why or when you should do it, and what the process actually looks like. Before I jump in, this resource would not have been possible without these incredible people who helped compile information and provided insight into their experiences so we could pull from a variety of different perspectives. So thank you to Shannon and Marilyn, Kathy, Stephanie, Lindsay, and Terry for all of your help in making this happen. To begin, I'm going to provide a brief overview of the degree options that are available within the field of clinical psychology, as well as the advantages and disadvantages to postbac positions. Next, I'll discuss types of postbac positions that are available, specifically which ones may be useful given your career goals, as well as how to find a postbac position, and then end finally with the process of applying for a postbac position. So when we're thinking about postbac positions as a whole, I think one of the big questions that we have to answer is, are they going to be useful given your career goals, given the degree that you're hoping to pursue? And because of that, I think it would be useful to begin by just giving a brief overview of what those degree options actually are. To start, there are a couple of master's degree options. So the first of which is a licensed professional counselor. These are also thought of or described as licensed clinical professional counselors or licensed mental health counselors. And LPCs can often make diagnoses and usually have specializations. So those specializations can be marriage and family counseling, substance abuse, or school counseling. And a second master's degree option is a master's of social work or a licensed clinical social worker, which you'll hear people refer to as an MSW or an LCSW. MSWs or LCSWs often coordinate services, and they also can serve in more public health oriented positions or provide therapeutic services independently. One thing that's unique to the MSW or LCSW positions is that the framework is often more social justice and system oriented compared to the other degrees. These, I think, are the two biggest master's degree options available. And then there are also two doctoral degree options that are common within the field of clinical psychology. The first is a Doctor of Psychology, or a PsyD, and PsyDs focus on clinical and applied aspects of psychology. So specifically the professional practice of psychology. Usually PsyD degrees will focus on administering evaluations, conducting psychological tests, providing clinical services, and conducting applied research. On the other hand, a Doctor of Philosophy or a PhD really focuses on research aspects of psychology. So developing research ideas, conducting a series of research studies, as well as analyzing these data on top of the clinical opportunities that are available. So if we're thinking about the nature of these degrees, a lot of times graduate school prep books and different graduate schools will describe these on a scale. So a clinically oriented position being something like a 1, a research oriented position being more geared numerically towards maybe a 7. So there's a wide spectrum of where these degrees fall. I think generally the master's degrees are going to be more clinically oriented or public health oriented, whereas the PsyD is going to shift a little bit more towards the research oriented side. So still clinically oriented, but the research is really targeting applied clinical problems. Your PhD is going to be even more research oriented. So the research is really going to be targeting theoretical or applied clinical problems as well. But in that balance between clinical and research work, it's going to shift more towards the research side. In addition to the nature of the degrees, there are a variety of different job options that vary based on these types of degrees. So on the left here, you'll see an LPC or a licensed professional counselor, which has a variety of different job options that are available. So if you earn your LPC, you have the opportunity to work in a private or a group practice, in a VA, a hospital setting, in a police or military base, as well as elderly care settings and rehab centers. As an MSW or LCSW, you have all of the opportunities that are provided here, as well as a couple of degrees or options that are more specific to the degree. So for example, MSWs can also occupy more public health oriented roles. LMSWs can coordinate services and often do coordinate services and therapy for individuals, groups, families, as well as communities. And lastly, LCSWs can make independent decisions about diagnoses and treatment. PsyDs have, again, the job opportunities provided over here on the left-hand side, and licensed PsyDs can also diagnose and treat different mental disorders. Lastly, a PhD has, of course, all the options over here, as well as the opportunity to work in a psychology department or in other clinical or applied settings. And again, licensed PhDs can also diagnose and treat mental disorders. Now, I'll say this is kind of the broad overview, and certainly there are exceptions to the rule, but generally these are the job options that are typically occupied by the degrees listed here. Another big factor when deciding a career path and a degree that you're interested in pursuing is the timeline and cost of that degree. So I've tried to make this easily comparable across the degrees so that here up at the top, you'll see the length is going to increase as you move from left to right here. So LPCs and MSWs or LCSWs, your master's degrees, are typically going to last 1 to 2 years in length. This is in stark contrast to your PhDs and PsyDs, which are going to be somewhere between 4 to 7, I think most typically 5 to 6 years in length. For licensure, the majority of the LPCs and MSWs or LCSWs are going to require at least 2 years minimum of post-grad experience that is supervised by a licensed clinician before you can apply for licensure and complete that licensure exam. So this is after you've obtained the degree, you'll be working under and supervised by a licensed practitioner in order to work towards licensure. PsyDs and PhDs usually require a little bit less supervised time, which is usually 1 to 2 years of supervised experience before you're moving on to that obtain licensure and complete that exam. One of the biggest areas in which these degrees differ is through tuition coverage and stipends. Tuition coverage is very rare for LPCs and MSWs. So these are going to be at the time of admission, what is the norm in the field? And for these degrees, the norm is no tuition coverage. You're responsible for the tuition yourself. Similarly, it's very rare in a PsyD to have tuition completely covered for you at the time of admission. The PhD, this is one of the areas in which I think they're most different, is that the PhD most commonly covers tuition for you. So the department that you're working for and that's granting you admission has also offered to cover most, if not all, of your tuition. And similarly, most of the LPC and MSW programs are not going to offer any form of a stipend for you. And similarly with the PsyD as well, in that it's quite rare to get a stipend through some of these programs. Whereas with this PhD program, it's almost always the case that you will have a stipend to live off of, pay rent, utilities, groceries, etc. It is a small amount, but it certainly is something that can be useful in not acquiring or minimizing the amount of debt that you take out during the degree. So given these different types of degree options, I think the natural question is which degrees will actually benefit from the postbac training? To be clear, all of these degrees require a bachelor's degree before pursuing a graduate degree. The LPC usually does not require a postbac position, so it's typically not needed. And if you do pursue a postbac position, it's usually the clinically oriented positions that are going to be the most beneficial. Similarly, a postbac position is not typically needed for an MSW or an LCSW. And if you choose to pursue one of these positions, it's usually going to be a more clinically oriented position that will be most beneficial to you. In contrast, the doctoral programs typically require a postbac experience prior to entering graduate school. So for a PsyD, usually a research or clinical research postbac position is required. And these are usually going to be positions like a research coordinator or a research assistant position that's suggested really to allow applicants to build their CV prior to graduate school. So to allow the applicant more specifically to acquire poster presentations or publications and to learn what it's like to work in a setting full time where you'll be conducting research. The same is true of a PhD. Postbac training is usually required and certainly something that you would benefit from if you're interested in pursuing a PhD. It's usually the research or clinically research-oriented postbac experiences that are recommended. So those are going to be things like clinical research coordinators or research assistant positions. And again, those are meant to help build your skill set, refine your research interests, and build your CV by acquiring poster presentations and perhaps publications as well. Marilyn made an amazing kind of overview of everything that we've described so far to give a visual understanding of what it is that we're talking about here. So I imagine that most of you are somewhere up here in your psychology undergraduate career where you are trying to decide what career path would be best for you and whether or not a postbac position would be beneficial. If you decide that you're mostly interested in clinical work, the degree option will likely require 1 to 2 years of graduate school that you can pursue at any point in time. So these again are going to be your LPC and your MSW degrees, and ultimately the goal then will be clinical practice. If we go up to the other side here, if you're mostly interested in research work, or you really like clinical work and you'd like your research to be a component of your career, then it's most likely that you'll pursue a doctoral degree, either a PsyD or a PhD in clinical psychology that's 4 to 6 years in length. And postbac training is typical, if not required, for these positions. So again, here are your PsyD and PhDs in clinical psychology, which yield, yes, to clinical practice and also to academic research and to teaching opportunities as well. One degree option that we haven't discussed so far is a PhD in a related field. So something like developmental, cognitive, quantitative, social, or personality psychology, which also allows you to do some of this academic research and teaching, as well as go into kind of what we call the industry jobs, which we can talk more about at a later time. But overall, this gives you a good idea as to the job opportunities that are available, as well as the training that's required and the postbac experience that's required in order to explore these different career pathways. So I think, the natural next question is, who are postbac positions worthwhile for? And the short answer, based on these degree options and the career goals, is that they're helpful but not required for LPCs or MSWs, and that they are highly recommended and required usually for PsyDs and PhD programs. Now, there are, of course, advantages and disadvantages to these postbac positions. We'll start with some of the pros, one of which is that you'll build a significantly stronger application. So you can imagine if you're working in a setting full-time, 40 hours a week, you'll gain experiences that are going to build that CV, to build your experiences that will better prepare you for graduate school. You will also have the opportunity to focus your research interests prior to entering graduate school. So maybe you know that you're interested in anxiety, for example. What is it within the field of anxiety that you're interested in? Is it the treatment? Are they the mechanisms that are involved in anxiety research? Is there a certain population or age that you're interested in, et cetera? So it gives you the opportunity to focus your research interests and also the experience of conducting research full-time. Excuse me. So importantly, you'll learn how to conduct that research full-time, as well as how to navigate different clinical and research challenges prior to entering grad school. You'll build skills, of course, within the context of the research that will help prepare you for graduate school. And more importantly, or perhaps equally as importantly, you'll develop important professional skills like navigating workplace conflict, how to schedule meetings with clients and participants, how to create and lead team meetings, receiving constructive feedback, seeking out supervision, all of these experiences that will make your graduate school training more worthwhile and certainly more productive. Lastly, postbac positions allow you to gain an extra letter of recommendation. So you will be developing new professional relationships in this new setting, which often lead to a potential letter writer, which can really strengthen, again, your application for graduate school. So overall, I think postbac positions strengthen your application and prepare you for both anticipated and unanticipated experiences in graduate school. There are, of course, a couple of cons that come along, and I think these are generally things that we hear on the front end of postbacs. So before applying to postbacs, a lot of people are worried about the potential difficulty of transitioning from full-time employee back to full-time student. So in college, you're already in the groove of working as a full-time student, and it may be difficult to transition into full-time work and then back to becoming a student and dealing with things like homework and exams. I will say personally, this is not something that I experience. In fact, I think for me, it was in part the opposite, in that work mode. So working a 9-to-5 job really helped me with work-life balance in graduate school, because now I view my graduate work as my job. So I can work within these hours of, 8 to 6, 9 to 5, whatever it may be, and then go on to really focus on self-care and forming and maintaining relationships, and et cetera. Another common disadvantage or fear that people have is feeling behind compared to those who enter graduate school immediately following undergrad. And I think that this is more relevant for people or peers who are in different fields like law school or medical school, where it's really common to move straight into undergrad. But because postbac positions are so common in clinical psychology, I think that this is something you'll find within the field isn't necessarily as big of a barrier. Before we move on from some of the advantages and disadvantages to talk about different types of postbacs, I did want to address a couple of frequently asked questions. The first of which is, which postbac setting is best for my career goals? So if I decide that I'm interested in pursuing a more research-oriented career versus a more clinically oriented career, what does that mean and how do I kind of fit that with my goals? If you're interested in exposure to both research and clinical experiences, an excellent opportunity would be working in a university, so an academic or medical center, or working at a medical institution or a hospital. And these positions are typically a project or program, or maybe a lab coordinator or a research assistant position. Those are generally the names that they're called. And really this allows for the opportunity to work with a range of PIs and labs to broaden your research interests and to gain those skills that are both clinically and research oriented. Intake coordinator, advocate, or clinical settings, on the other hand, are better geared towards those who are interested in pursuing clinical work full-time. So if you're interested in a master's degree, but you're not quite sure which direction you want to go, it can be really useful to pursue a postbac position, not because it's required, but because it can help kind of elucidate some of those interests. These positions provide experience or exposure to appropriate settings and situations. So for example, you will gain experience in a clinical setting, which will be useful before you begin seeing patients of your own in a graduate school setting. Another frequently asked question that we get is, what about a strong postbac opportunity that falls slightly outside of your main area of research? Now, ideally, your interests overlap. It doesn't have to be a perfect fit with your postbac position, but it can be difficult to find a postbac job that exactly aligns with your research interests. If this is the case, some labs and PIs have the opportunity for extracurricular research, in which case you can incorporate your primary interests into those of the faculty member. So for example, many research labs collect additional data and information that's slightly outside of the scope of their research question, which makes it feasible to investigate research questions and publish content that's slightly more relevant to your area of interest. So for example, if you are in a depression lab, maybe there's an anxiety measure, if you're interested in anxiety, that's incorporated into the research there that you can then ask a related question from of your own. There's also the opportunity for extracurricular research. So if this is something that you're worried about and you provide and you jump into a postbac position, that's a great training opportunity, but it's slightly outside of your primary area of interest, you can pursue extracurricular research. So Perhaps you are working with a PI in a different lab by collecting data or helping do recruitment through this lab. And that will allow you to kind of gain some additional experiences slightly in a different setting. Ultimately, though, I think that the training is more important than the subject of the research. Ultimately, the goal of postbacs are to prepare you for graduate school by building up those skills and giving you the experiences that are really going to help you transition to a graduate setting. And so if you have a strong training opportunity, I would encourage you not to write it off if it's just slightly outside of your area of interest, because the training, again, more important than the subject. Lastly, a question that we get a lot is, what about supplementing postbac experiences with volunteer positions? So for example, you could go and work in a slightly different setting in addition to your postbac full-time research experience. And I think generally going above and beyond can only help you, right? So this could be that you're volunteering to assist with publications in a different lab, or like I mentioned, offering to assist PIs with data entry or recruitment in a different setting, volunteering for a crisis hotline, which are all experiences that will bolster your CV and your application. The important caveat here is to consider time management. So it's better to do one thing really, really well than it is to spread yourself thin across 2 to 4 different things. So if it's something that you're generally interested in, absolutely pursue it, but don't overcommit or sacrifice your work productivity in your full-time setting or your self-care. So often it's feasible, for example, to schedule in maybe 2 to 4 hours of volunteer time after work or on a Saturday morning. That can be a nice complement to your full-time postbac experience without necessarily pulling you away from it so that you're overextending yourself. All right, so shifting gears a little bit, now that we know the degree options that are available, the benefits of a postbac position, what are the types of positions that are available specifically within your area of interest, whether that's more clinically oriented or more research oriented? First, I'll begin with some of the more research-oriented positions. So one type of postbac position is a research or project coordinator. These are usually at a hospital or a university setting. They're often also called lab managers, research assistants, or research analysts, and they all mostly mean the same thing. So in any of these positions, you'll be gaining experience managing and working with undergraduate research assistants. You may be helping with study recruitment and likely with management. Another big part of the job is data management and quality assurance, as well as creating and maintaining the IRBs for each of the studies that are being conducted in that lab or hospital setting. It may be the case that you're able to assist with the preparation of publications or presentations through the study. This is an opportunity that you usually need to be proactive about, but certainly is an opportunity that would be valuable during your postbac experience. And then in almost all of these settings, you'll be running study visits, which includes contacting families or participants, consenting those participants, administering assessments, and likely debriefing and compensating them as well. The benefit of a research coordinator position is that you get to see the research process in a variety of different places. So hopefully, if you're doing a 2-year postbac, you'll be able to see it from start to finish, where you can help create and maintain the IRB. You can see through data collection and data analysis, and then hopefully publication as well. Another type of research-oriented postbac position is a VA research coordinator position. These positions are very common and also are very similar to the responsibilities of a research coordinator position in a university or hospital setting. So the common responsibilities include coordinating projects, conducting interviews, but the difference between these and those research positions I just talked about is the population. So the VA research coordinator positions through the Department of Veterans Affairs are going to be geared exclusively or almost exclusively towards veterans. So it may be the case that you're scheduling services for veterans within a project, conducting one-on-one interviews with veterans receiving services at the VA. You may serve as a liaison between a project team and participating veterans. It's also possible that you're conducting assessments and scoring and then interpreting and summarizing those assessments. You may be following up with veteran participants and managing and maintaining study databases, entering data, doing things like this. So again, really similar in some ways to a research coordinator position in a university or hospital, but the population itself may differ. So for example, you may be working on a project designed to better understand how older adult veterans, what their healthcare values may be, for example. Similarly, to the VA research coordinator positions are DOD contractor positions. So these positions are affiliated with a military university. And I asked Terry to help me gather some information about these because this is something that they were able to do during their postbac time. Terry described finding a job on LinkedIn through the job search alert in a certain research area and research for that, and then applying through the company's website portal. I think this is a slightly different process than some of the other research coordinator positions. So if a DOD contractor position is something you're interested in, I think that this would be a great avenue to explore. Terry mentioned that there's also some emphasis on previous experience or connections to the military, which is an important thing to be thinking about if this is an avenue that you'd like to pursue, just in your connections to the military and the role that you'd like it to play in your job. Now, those are all research-oriented types of positions, but of course, there are clinical options as well. The clinical options are often going to be intake coordinators at a clinic, at a university clinic, or in a private practice, where you're administering pre-treatment assessments or maybe intakes for the clinic. You will likely do some billing and processing as well as some scheduling. You may be coordinating client sessions and other administrative duties. And then if there is research going on, particularly at a university clinic or a clinic affiliated with a university, the intake coordinator may also be able to get involved and assist with posters or publications from that perspective. If a research position is something that you are pursuing, which is often the case, a great way to gain clinical experience is through volunteering. So this is another clinical option where you could work at a selective mutism or other clinically oriented summer camp, volunteering at a clinic like this, for example, or shadowing sessions, helping with groups, doing things like this. And so I think that the research opportunities, of course, provide a heavy research component, and they can be complemented if this is something you're interested in as well through these clinical options. Additional clinical options include policy, efficacy, social services opportunities. Specifically, there are some opportunities available such as through the Child Advocacy Center and through the Child Psychiatry Access Program, which is often housed in hospitals, outreach, or care management centers. And you may serve as a coordinator in one of those roles by following up with families, scheduling visits, conducting the outreach or family satisfaction with care, coordinating referrals, etc. So there are a lot of different options that are available from a clinical postbac perspective as well. All right, so we know that we want to pursue a postbac. We've reviewed the degree options, the pros and cons, and the types of postbac positions. Now the question is, how do we find one? There are a variety of different ways, the first of which is through online resources. There's a program that the NIH offers called the ERDA Program, which stands for Intramural Research Training Award. And it's a postbac program run by the NIH that selects undergraduate students and mentors and pairs them together based on similar research interests. If this is something that you're interested in, you can apply directly through the NIH website. I've listed the website here for you if you'd like to write it down. But this is a great opportunity to be paired with somebody or with a specific mentor or PI that has interests similar to yours. Another online resource that's really useful in finding a postbac position is through opportunities like website postings. Clinicalsitegradschool.org is one of the most common. It is a forum that was created to allow for a place where everybody could post different job postings all within this field of clinical psychology. So if you go to the link listed here, you will see a variety of different job postings that are listed as they become available to you. So when I was applying for postbac positions, this was the one that I used maybe the most because you can refresh it every day and see the new postbac positions that become available. And there are a lot that start to stream in through that spring semester. So it can be really useful resource for finding positions from all over. There are also a variety of other websites and online resources. Some are run through universities but are accessible to anyone. So for example, Harvard has a postgraduate research job listing, as well as Swarthmore College, who's done a great job creating a Google Drive for all of these different positions. There are also a series of different websites here that are created by graduate students, by professional organizations, or by other people who compile all of these postbac position postings into one place and can be great resources to use if you're looking for positions or when you're looking for these positions. In addition to online resources, another opportunity or way to find postbac positions is through Googling and emailing PIs. So many PIs don't advertise their positions on these online forums. And so you can find a PI by Googling the names of authors on papers that you find really interesting. And this is a good way to look for labs that are in line with your research interests. So most labs and clinics have a website that you can look through for current studies and team members. And if not, you can reach out to inquire anyways. There are often these lab and clinic websites that can provide some information, if not just contact information for you. And you can either email the PI directly, or you can look up the lab and see if there are any research coordinator or faculty positions or faculty who know about positions that are available. So sometimes the PI isn't the one that's hiring or managing the hiring directly of research assistants. So it can be helpful to reach out and figure out who's the best person to talk to. When you are ready to reach out to a PI and email them about a potential postbac position, there are a couple of really important things to think about. The first of which is that you need to keep it simple. So you want to explain who you are and briefly describe your previous research experience or your goals and why you're interested in this PI's work. You can also offer to provide a CV upon request, but really the important thing here is that you are keeping this as brief as possible. I think the rule that I was given, or the suggestion I was given, was 1 to 3 sentences, because these PIs are really, really busy, and the longer the email, the less likely that they will have the time to read it and respond accordingly. So when I was applying for postbac positions, I think my emails said something along the lines of, hello, my name is Sarah Jessup. I'm a senior at UNC, majoring in psychology, minoring in neuroscience. I've spent the last 2 years working as an undergraduate research assistant in Dr. So-and-so's lab and plan to apply for a postbac position before applying to clinical psych PhD programs. I'm writing to ask whether you are hiring any new full-time research assistant or research coordinators for the upcoming year. And that was the whole email. It's 2 to 3 sentences, really keeping it brief, and hoping that you hear back from some. It is the case that some faculty members won't know, or they'll respond and say that the postbac positions depend on grant funding. So if they're awarded a grant, they'll have the money and need for a postbac position, and some will really be in kind of this waiting period. But it can be helpful to get your name out there to let them know that you're interested. A couple of really important notes. The first of which is that you want to do this early enough that you get your name out, but not so early that that enough time has passed that they have kind of moved on. So a good time to do this is in January or February. And I think most importantly is that emailing PIs about whether or not they're hiring a postbac is not an opportunity to send a pre-application. Instead, this is simply a way to determine whether they have a position available. So you want to keep this very brief. Don't go into a lot of detail. Explain who you are, what you've done, and what your career goals are, and that is plenty here. In addition to emailing PIs and online resources, there are a couple of additional methods that may be useful. I think the biggest of which is listservs for professional organizations like ABCT. So if you're watching this episode, it's likely that you are familiar with ABCT, and they do a great job of providing job postings on their listservs So if you can join the email listserv, there are often postbac positions that are posted that you can apply directly through the listserv. So there's an email listed that you can apply through directly. There are other professional organizations, of course, as well, that are great. I've listed a couple of here that really complement some of the research and may be useful as well. And lastly, some positions are found on Indeed, although you'll likely have difficulty if you just search for postbaccalaureate positions. Instead, I try searching for terms like research technician or lab manager, research specialist maybe, that might complement searches for research assistants. Once you know what type of postbac position you'd like and you're looking to find one, an important thing to think about is how long the postbac position should be. Typically, postbac positions are 1 to 2 years, though 2 years is more likely to be fruitful if you're using the job to apply for graduate school. Since graduate school applications begin in the summer and in the fall, having a 2-year position gives you enough time to get experience under your belt and possibly work towards publishing or presenting at conferences before you're applying to graduate school. Only working in a 1-year postbac position means that you'll only be there for a couple of months before you start actually applying for graduate school. So it's unlikely that your supervisor could serve as a letter writer. You'll also have fewer experiences and learning opportunities to speak to in your application and interview process. So most commonly, and I think most recommended, is a 2-year program. It's ideal also to have some sort of undergraduate research assistant or experience before you apply for a postbac position, though this isn't always necessary. But if you're early on in your undergrad degree, it can be a useful thing to begin thinking about now. The process of applying to postbac positions can look quite different across different types of positions and placements and settings. So you'll see a really large degree of variation here. There is also some variation in the deadlines for these positions. So some have a call for applications and a specific deadline that's mentioned, and others, maybe through professional networks, are going to review applications on a rolling basis, which really highlights the need to submit these applications early on, as soon as the jobs are posted or shortly after, in order to be considered for the jobs themselves. Now, of course, like I said, there's a large degree of variation, but generally the initial application will include a cover letter, an application with general information and prior experiences, perhaps a resume, and then a series of reference letters. So usually this is 2 to 3. I pulled a job posting here that I found recently on a listserv, so just so you can see what it looks like. You'll see that this specific job posting asks for a letter that addresses the information listed below, as well as contacts for 3 references, and that the letter and resume and references are submitted as an attachment to an email, so directly applying to a specific person instead of through a university themselves. So again, the cover letter, it looks like, should address your career goals as well as your initiative, your prior experiences, as well as some of your software experiences as well. Starting earlier on in this process, I think, is better just because it gives you more time. There are rolling applications, but that generally means starting somewhere in the winter for these. So somewhere between maybe January and March. For the NIH ERDA program specifically, the applications are suggested 3 to 6 months out before beginning training. So if you are looking to begin training in June, you would likely submit that application sometime between January and March. So that's something to keep in mind if you're interested in the ERDA program specifically. One last thing I wanted to say about the initial process is that Terry mentioned the DOD contractor position sometimes ask for writing samples. So this could be, for example, a senior honors thesis, an independent study that you've collected, or maybe a research project or paper that you've written for one of your psychology classes. But keep that in mind that that is something that is sometimes asked for during that initial application. After the initial application is submitted, there's usually somewhere between 2 and 4 interviews, which are a combination of phone interviews, video calls, and in-person interviews. And during these interviews, really what your focus will be is highlighting your skills, showing some interest in the position, and asking questions that will help you assess whether you'd be a good fit for this job, but also whether this job would be a good fit for you and your career goals. So during interviews, a good way to assess whether the position would be a strong training experience, for example, so not just entering data and doing administrative tasks, is to ask questions such as where previous individuals in that position have gone after their postbac. Are they in a PhD position or a program, a PsyD program? Are they in a master's program or a related field? Just to get a sense of what it is that people ordinarily do after this position. You can also ask what types of opportunities might be available, excuse me, for independent projects like poster presentations. If you're applying during your senior year, the process is later than other jobs. So this is something to keep in mind because oftentimes your peers will be applying for positions and receiving job offers in the fall. And this is not the case with clinical psych PhD programs. So I remember this was something that I was anxious about, given that it starts a little bit later. It usually is something that starts in the winter because people are applying for positions and starting to recruit once current postbacs have accepted graduate school offers. Generally, this happens by April 15th. So you can see that the process is shifted a good bit later than maybe some of these other positions, and that you'll be applying in March, April, May, maybe even June of your senior year for many of these positions. So just to summarize everything, I think the importance, focus, and benefits of postbac positions really depend on your career goals. Postbac positions can also be a great way to discover what you don't want to do. So testing out research before committing to a doctoral program, for example. So a question that we hear a lot is, what if I don't know what I want to do? And I think that postbacs can be a really great opportunity to explore that. We also think that postbacs have a lot of different options and opportunities available. So I hope that you have found this talk helpful, and best of luck with the process.